Environmental hazards include falls, transmission of pathogens, pollution, and natural disasters or man-made disasters. Factors that increase a patient's risk for falls include patients over the age of 65 with a history of falling, patients with reduced vision, orthostatic hypotension, gait and balance problems, urinary incontinence, or use of walking aids or assistive devices, and effects of various medications. Transmission of pathogens can be reduced through medical and surgical asepsis, immunizations, adequate food, sanitation, and insect or rodent control, as well as using appropriate disposal of human waste. Proper hygiene and immunizations can reduce or prevent disease transmission from person to person. A pollutant is a harmful chemical or waste material discharged into the water, soil, or air. In healthcare facilities, noise pollution can contribute to sensory overload. Natural and man-made disasters include terrorism and bioterrorism and can be devastating. Nurses need to be prepared through education and training to respond to threats of patients if such incident occurs. Reducing physical hazards in the environment includes providing optimal lighting, decreasing obstacles such as rugs, cords, wet spots on the floor, clutter, and shoes, and providing safety prevention for falling, such as grab bars and raised toilet seats in the bathroom. Sources of poison include medicines and cleaning equipment, as well as other solids, liquids, and gases. The elderly and young are very extremely susceptible to fire and poisoning. The leading cause of fire-related death is careless smoking, especially when people smoke at home in bed. When providing safety considerations for the older adult, nurses should consider that older adults have visual and hearing alterations. Some older adults have slowed reaction times, and many have range of motion, flexibility, and strength that's decreased. Reflexes are slowed, and the ability to respond to multiple stimuli is reduced. Elderly patients often have nocturia and incontinence, and are more frequently using the restroom in the middle of the night. Elderly patients sometimes also have impaired memory, and the high prevalence of chronic conditions and their high number of prescriptions and over-the-counter medications all contribute to their risk for falls. When a patient is assessed as a fall risk, most hospitals have fall prevention protocols that are instituted. For example, a patient will receive a yellow fall risk identification bracelet and will be given information about preventing falls and will receive additional nursing interventions to prevent falls. At minimum, nursing assessments need to be completed on admission, following a change in the patient's condition, after a fall, or when a patient's transferred. Falls that result in injuries often extend a patient's length of stay, placing them at greater risk for other complications. Using a fall risk assessment tool can be helpful to identify patients at risk for falls. For example, the fall risk assessment tool, as shown here, shows indications that increase the patient's risk for falls. The more the patient has going on, the higher the number, the greater the need for interventions to prevent falls.